actually.
Hello, my name is Dr. Mark Thompson, and I just wanted to give you a quick office tour of Dynamic Kairos. This is Sylvie. She's our new addition, Dr. Sylvie, we call her. When she's not in the office, patients get very angry. So, a couple things I want to show you, just as an update that we've had happen over the past year or so. We've got an electronic sign-in for everybody to come in and mark their symptoms and input, and that shows up on our electronic medical note record in the back. So that's really nice. A couple check-in stations there. We'll move kind of quick, so bear with me. We've got here a decompression unit and kind of an open rehab area here. But the decompression we use a lot of times with people where they've had a lumbar disc herniation or a disc bulge. It works really well as a non-surgical treatment option for that particular condition. You can see here we've got a couple of different traction units. So we do a lot of different changes in postural distortions and help people correct those problems. So this is a standing unit, so if somebody needs to lean to the side and then we need to do some traction, we can do that. We have a lot of different bands in different areas of the clinic for people to be able to do some exercises. This particular one is a neck band where people can really strengthen the neck and the deep core neck flexors. We've got a couple different traction units here. This is called a Dental table. And there's a bunch of different configurations, which basically allows us to handle any postural distortion that somebody has, as well as a universal traction system, which also allows us to handle any configuration that somebody might have. You can see we've got different bands here as well. We've got different balls and twist bands for, name it, from tennis elbow to shoulder problems where we need to work on people's shoulders. We can do that. What else do I want to show you? We've got a couple different adjusting tables. These are kind of a semi-open, semi-closed room, so people still have their privacy when they get adjusted, but at the same time, it's semi-open, so they can kind of learn as other people are learning at the same time. We have an electronic record keeping system called ChiroTouch, so everything gets input into ChiroTouch, as well as anything that we get via paper. We can scan that directly into their record, so that's really sweet. Come on back here. We have a wall of fame, so if you do really well with your corrections, then sometimes you can make the wall of fame. Got a couple different areas where we'll hand out different exercises and rehab sheets, so this is just one of them. You can come on in here. This here, really excited to show you. This is, we upgraded to a digital x-ray unit over the last year, and then we purchased a software called Posture Ray. What's really great and excites me about this is we can basically look for alterations of motion segment integrity with our particular motor vehicle accident clients. And with this, if I was to show you, I probably should have had it up ahead of time, but that's okay. But if we view the report, then what you can see on these is you can actually see if there's an unstable unit in a particular part of the spine. So for instance, in this one, this is showing here that there's actual ligament laxity because of the accident itself. And so we can measure down to the millimeter, even sometimes a little bit more than that. But essentially it tells us exactly how far out of alignment the spine might be and if there truly is ligament damage done to the spine. So that's good. Very important. We've got a couple different exam rooms where we can do the exam and we can do a report where we can close the doors, tell people what's going on, let them know about their treatment options. A couple different educating tools so people can see if that nerve, what area it's affecting in their body. Let's go on back here. Back here, we've got a laser room, so we've got a laser unit that's coming in a couple of weeks. So then for people with acute trauma, we can use the laser for that. And then I'll be a little quiet, but we have 2 massage rooms here, so we have massage therapists that can apply that therapy as well. If you have any questions or you'd like a tour of the office, just give us a call at 425-827-2225. It's dynamickairos.com, and thanks for watching.